name is Dr. Jyoti Randhawa, and I'm the Chief Medical Officer of Silver Oaks Behavioral Hospital. Joining me today is Katie Hoy, the Director of Social Services at Silver Oaks Behavioral Hospital. And today we're going to talk to you guys about youth and family and the recent changes. All right, so first important question of the day is, what is the new normal?
So we are all adjusting to this concept of a new normal, everything from e-learning to social distancing to parents trying to work from home while also helping their kids with e-learning. We're seeing all of us, especially children, are spending less time with peers and more time with family. So a big impact of that is the change in structure and routine that seems to be happening an awful lot naturally with these changes.
And needing a structure is so important. It's a fundamental basic that we all need. We are creatures of habit. So when we have a structure that we can follow, it helps us normalize our day-to-day activities. It helps us feel in control because at this point, let's be honest, we feel the lack of control, all right? And having some control can ease our anxiety and it can help us feel safe. And as parents, when you model this behavior with the above, mentioned factors of feeling safe, less anxious, you model the behavior you want your kids to follow so that they feel safe and comfortable through this time too. But structure is very important, and having that, I would guess that with the whole changes of family being at home with their kids, there may be some pushback or some changes in behavior that parents are seeing, correct?
Absolutely, and change is hard. Change is hard for anyone, and we're all experiencing drastic changes right now, and pushback is normal for kids, and being able to talk with your kids about what is going on in the world is so important. And that certainly will look different for a preschool age child versus a high school age child, but regardless of the age, validating how they're feeling, validating this current experience, answering their questions and allowing them to ask them is so important. And paying attention to any changes you might be seeing with your kids at home. And Dr. Randhawa, as a child and adolescent board certified psychiatrist, what are some symptoms or warning signs that we can look for in kids and their mental health?
That's a really good question. I think this is a time that parents are spending with their kids, and if you start noticing any changes in behavior, that's a very important thing to know, guys. If you are noticing any particular changes in your child, change in their sleep pattern, change in their appetite, change in the way they interact with you, siblings, they're more irritable, more withdrawn, those are your red flags to seek more help.
And if parents do see that and they start to worry about some of those symptoms or warning signs, what do they do?
I think for parents, they have to seek help. They need to get their questions answered. So if there's an emergency for any mental health issues, obviously the first thing you want to do is call 911. But if there's a non-emergent issue, then we have places like ours, Silver Oaks Behavioral Hospital, and we're here 24/7, where folks can either call, come in person for an assessment, do a telehealth evaluation. You can visit our website for the information and give us a call, and we can help answer those questions and do an assessment through a licensed clinical intake worker and help folks get the services they need.
Absolutely.
All right, so I hope that's helpful for the families out there, all right? And Katie, thank you so much for being a part of this conversation today.
Thank you for having me.
You're welcome.